Excellent. So let's have our audience respond again, and then we'll have a little rebuttal. Is OCT a useful test for discriminating between pseudopapilledema and papilledema? What do you think? Were you convinced?
Should have music.
Aha. Well, so let's hear from our panelists, please. If you want, any, yes.
Anybody else?
Yes, no, go ahead, go ahead.
Stacy, go ahead.
Me?
Yeah.
With what?
With what do you think? Since you're the one who.
Okay, go ahead.
Well, I mean, first I'll just give you a chance if you have a rebuttal to each other.
Oh, rebuttal to each other.
Yeah.
I think we both said the same thing, basically. Although she's saying no, she did say it's a combinatory approach, and I'm pretty sure you're getting OCTs on your kids. So despite the fact that you're arguing no, I'm pretty sure you're getting it.
But maybe comment on fluorescein angiography, because that's the elephant in the room here, and
So
the moderators can talk
So
to that.
here's what's funny. So fluorescein angiography has been present for decades. It's not a new thing. OCT's been there since, 2005, 15 years. And OCT is being used so much more than fluorescein angiography, in this in particular, because it's so much easier to use. And the other thing is you can actually follow over time. That's the most important part of it, is that you're not going to get the kid to do a fluorescein angiogram every single time they're coming, and distinguishing resolved optic nerve edema while you're still in the same grade, so you were a high grade 2, now you're a low grade 2, is not as easy with a fundus photo. You do need another modality. It's either fluorescein or OCT, and OCT is easier to obtain.
Is there a global RNFL OCT number, micron number, that you would feel comfortable that this is definitely papilledema, over which some global number that this is taking me out of my comfort zone, that this could be Berry drusen?
So on looking at the RNFL itself, I think the sensitivity, the sensitivity was something like 85%. It's not 100%. But when we looked at the RNFL in combination with the Bruch membrane opening, we raised the sensitivity to about 98%. So the number, I think, was 135 on the RNFL and a 1650 on the Bruch membrane opening.
Well, I convinced some of you, not all of you. But I would say that when you're confronted with the patient and their family, day one, is this papilledema, is this drusen? I think in this particular case that you didn't waffle a little bit on the symptoms. They had no symptoms, 12-year-old. 12-year-old can go through a fluorescein, no problem. But I think the most important issue here is, in your practices, do you have the expertise to look at all of those subtle OCT findings that Dr. Eldari was talking about to be confident that the child does not have papilledema? That's really the crux of the issue. Does this child have papilledema and drusen? You never want to miss that papilledema case.
By the way, if we go back, I don't know if you have the results on that case you showed us, but if you go back on the fundus photo, that they were visible drusen and there looked like there was a CNV next to the nerve. If you do an FA on that one, it's going to leak.
Yes, I think that's not really the focus, though. The focus is, what is your sort of first line approach towards this? And I think maybe have the summary slide, please.
Summaries?
Yes. So just to summarize, and I think it's true that really we make this artificial distinction between pro and con, but really it's probably more of a combination between the 2 points. But just to summarize, Dr. Eldari's point is that we can use OCT. There are some features that discriminate between disc edema from papilledema and optic nerve head drusen, but it's not foolproof, and so we have to be thoughtful in terms of the clinical context and use other diagnostic tools to inform us. So, and I think that's really consistent with what Dr. Gordon also is presenting, that sometimes it's challenging to use OCT to really identify the drusen. There may be other modalities such as fluorescein or ultrasound that gives us more information, and a combinatorial approach is probably the most favorable approach because the stakes are very high and we don't want to miss papilledema in these patients. So thank you to our panelists.
Thank you. That was great.